Welcome, and thank you for joining me for today's educational session, Planning for Healthcare and Retirement. My name is Joseph Budd, and I'm a certified financial planner and managing partner with Budd Wealth Management. We have developed and refined a process over the last 20 years to work with families that aspire to a work optional lifestyle. We help to put all the pieces of the financial puzzle together for our clients. Connect with us on social media where we post interesting personal finance content on a regular basis. Planning for healthcare and retirement. Thanks for joining me today for this discussion around planning for healthcare in retirement. With more baby boomers retiring and living longer, the need to plan for and fund healthcare expenses in retirement is growing rapidly. Today, we'll examine the challenges retirees face, delve into the key components of retiree healthcare, such as Medicare and long-term care, and finally discuss planning considerations for your overall financial plan. So it's clear that healthcare costs are rising and pose a significant challenge for retirees. But how do your healthcare costs compare with overall inflation and wages from employment? The answer is striking. Since 1999, healthcare costs have risen cumulatively by over 230%, while inflation, as measured by CPI, has risen roughly 50% and wages only 68% over that same period. The trend is expected to continue in the future as overall spending for healthcare is projected to exceed overall inflation. Healthcare is the only component of household expenditure that increases with age, both in terms of absolute dollars and as a share of total household expense. For example, in 2015, average annual out-of-pocket healthcare expenses for a household between ages 65 and 74 was $4,383, capturing on average 11% of the total household expenses. For households ages 85 and older, the average out-of-pocket healthcare expense increased to $6,603, capturing 19% of total household expenses. Uncertainty about some of the key components of healthcare costs, like diagnosis of a life-threatening condition or needing long-term care, causes many retirees to be apprehensive about their healthcare cost needs. Also, for many, these expenses could be backloaded, reaching peaks toward the end of life when resources are slim. So, for successful management of resources in retirement, it is crucial to plan well for healthcare expenses. HealthView Services 2019 Retirement Healthcare Cost Data Report is derived from 50 million actual healthcare cases and a wide range of additional data sources. The average lifetime retirement healthcare premium costs for a 65-year-old healthy couple retiring this year of 2019, covered by Medicare Parts B and D, and the supplemental insurance policy will be $419,262. It's assumed that Medicare subscribers paid Medicare taxes while employed and therefore will not be responsible for Medicare Part A premiums. A couple can expect to roughly $1,000 a month during their first year of retirement. This monthly expense is probably close to what they would be accustomed to paying if they were enrolled in an employer-sponsored plan. However, this number will more than double by age 85. Another key factor for clients in retirement is their health. You might assume that unhealthy retirees will face a greater burden when dealing with healthcare costs in retirement. In fact, due to shortened life expectancy, the opposite is true. Healthy retirees face more risk because of increased longevity. One of the most important factors contributing to the decline of availability of retiree health care benefits was a 1990 accounting rule change. The Financial Accounting Standards Board, FASB, issued Financial Accounting Statement 106, Employers Accounting for Post-Retirement Benefits Other Than Pensions, in December of 1990. And it triggered many of the changes that private sector employers have made to retiree health benefits. FASB 106 required companies to record retiree health benefit liabilities on their financial statements in accordance with generally accepted accounting principles beginning with the fiscal years after December 15, 1992. Specifically, FASB 106 required private employer plans to accrue and expense certain payments for future claims as well as actual paid claims. The immediate income statement inclusion and balance sheet footnote recognition of these liabilities dramatically affected companies' reported profits and losses. With this new view of the cost and the increasing expense of providing retiree health benefits, many private sector employers overhauled their retiree health programs in ways that controlled, reduced, or eliminated these costs. If your retirees are receiving employer health care benefits, more will rely on Medicare in the future. With increasingly longevity, baby boomers retiring, and current federal government debt, there will be pressure in the future to pursue entitlement reform. This could result in higher taxes, reduced benefits, or both. For those who do require long-term care, the costs are staggering, especially within skilled nursing facilities. Due to these costs and other factors, other less costly options such as home health care have been growing at a rapid pace. In summary, retirees will increasingly need more guidance around planning for health care in the future. This presents many issues to address as these savings and needs need to be addressed to have an accurate depiction of what one's cost might be in the future during retirement. Let's start with the biggest component of retiree health care, the Medicare system. Medicare is health insurance for people 65 and older, people under 65 with certain disabilities, and people of any age with renal end-stage disease, which is permanent kidney failure requiring dialysis or kidney transplant. Generally speaking, you should be eligible for Medicare at age 65 if you are a U.S. citizen or a legal resident and you've resided in the United States for a minimum of 5 years, or worked at least 10 years in Medicare-covered employment. Here's a summary of the 3 main parts of Medicare. Part A, there is no premium, assuming you paid payroll taxes while working. Part A provides inpatient care in hospitals, skilled nursing care facilities, hospice care, home health care. For long-term care in a nursing home, you pay nothing for the first 20 days of each benefit period and co-insurance for days 21 to 100 of each benefit period and all costs for each day after 100 days in a benefit period. Part B is medical insurance, which helps cover medically necessary doctor services, outpatient care, home health services, durable medical equipment, and other medical services. Part B also covers many preventive services. You pay nothing for most covered preventive services if you get the services from a doctor or qualified healthcare provider who accepts assignment. Part D is Medicare prescription drug coverage. One is through Medicare prescription drug plans. These plans, and drug coverage to original Medicare, some Medicare cost plans, some Medicare private fee-for-service plans, Medicare medical savings account plans. You must have Part A or Part B to join Medicare prescription drug plans. The second is through Medicare Advantage plans like HMOs and PPOs that offer prescription drug coverage. Note that some of the items and services that Medicare doesn't cover are most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, acupuncture, and hearing aids and exams for fitting them. For 2021, Medicare Part B premiums start out at $148.50 a month. However, at higher incomes, certain retirees may pay higher premiums. Note that due to a hold harmless provision, some Medicare beneficiaries will pay a slightly lower premium. A hold harmless provision in the Social Security Act disallows an increase in Medicare Part B premium for qualifying Social Security recipients if their cost of living adjustment is not large enough to cover the increase in the Part B premium. To avoid potential penalties and coverage gaps, it is critical to understand how Medicare enrollment works. Most individuals should consider enrolling during their initial enrollment period, which is a 7-month period around their 65th birthday. If you're already receiving benefits from Social Security, you'll automatically get Part A and B starting on the first day of the month you turn 65. Enrolling when it's available is very important to avoid penalties. Additionally, there are other enrollment periods to be aware of. For example, open enrollment. This occurs every year between October 15th and December 7th and allows retirees to make changes to their coverage. Medicare Part D plans enrolling in or changing Medicare Advantage plans. There is also a period from the beginning of the year through mid-February that allows you to disenroll from a Medicare Advantage plan. Lastly, for Medigap plan coverage, there is generally a 6-month open enrollment period that starts when you turn 65 and are enrolled in Medicare Part B. If you miss this period, you may be subject to underwriting standards on your policy leading to higher premiums, such as pre-existing conditions. So it's very important to enroll when you're eligible. Medicare imposes late enrollment penalties to encourage retirees to sign up when they're available versus waiting until they need health care services. In most cases, if you don't sign up for Part B when you're first eligible, you have to pay a late enrollment penalty for as long as you have Part B. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B, but didn't sign up for it. Additionally, you may have to wait until the general enrollment period from January 1st to March 31st to enroll in Part B, and coverage will start in July of that year. Although your Part B premium is based on your income, your penalty is calculated based on the standard Part B premium. Usually you don't pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. But if you fail to enroll within the special enrollment period, the Part B penalty clock is reset to the time when you retired from your group insurance ended and not when your special enrollment period expired. Since original Medicare includes deductibles and coinsurance that could lead to significant out-of-pocket expenses in retirement, many retirees opt for supplemental insurance to cover these costs. First, Medicare Advantage plans that bundle Parts A, B, and D into one policy. There are several types, including Medicare preferred provider organizations, or PPOs, which is a network of doctors, clinics, and hospitals and other healthcare providers. With this type of plan, you don't have to choose a primary care physician up front to coordinate your care. Medical Health Maintenance Organizations, or HMOs, a plan in which you choose a primary care physician who will coordinate your care and refer to any specialist you have to see. An HMO typically is a network for healthcare professionals, and going outside the network could require you to pay completely out of pocket for any services. And there's other plans such as Medicare Private Fee for Service, Medicare Special Needs Plans, and Medicare Medical Savings Accounts. Alternatively, some retirees opt for original Medicare and purchase separate Medigap policies to cover at least some of the out-of-pocket expenses incurred. Here's some of the additional information on Medigap plans. You pay the private insurance company a monthly premium for your Medigap policy in addition to the monthly Part B premium you pay to Medicare. The GAP policy covers only one person, so if you and your spouse both want coverage, you'll each have to buy a separate policy. You can buy a Medigap policy from any insurance company that's licensed in your state to sell one. Policies are grouped letters A through N. All plans with the same letter must offer the same benefits. Certain plan types are not available to new subscribers. No higher premiums for those with pre-existing conditions who enroll during the open enrollment period, which is the 6-month period when you reach age 65 and are enrolled in Medicare Parts A and B. Any standardized Medigap policy is guaranteed renewable even if you have health problems. This means the insurance company can't cancel your Medigap policy as long as you pay the premium. Medigap policies generally don't cover long-term care, vision, dental care, hearing aids, eyeglasses, or private duty nursing, and do not provide prescription drug coverage. Here's a visual that highlights the two paths retirees can consider for supplemental coverage. Given the risk of significant expenses in retirement, it may be prudent to consider long-term care coverage to mitigate that risk. There are several different options for meeting that risk, including, for example, government care relying on Medicaid, which requires a spend down of your assets. Family members, self-insurance, setting aside a certain amount in the event long-term care services are needed, and long-term care insurance. When considering long-term care insurance coverage, there are a myriad of important factors. For example, is there an inflation provision that protects against rising costs in the future? What type of daily benefit amount is appropriate? These are just some of the factors involved in considering long-term care insurance. A big issue facing certain retirees is how to bridge the gap in health insurance coverage when retiring before the eligible date for Medicare at age 65. In fact, many workers base their retirement decision primarily around this challenge. However, a recent study suggests that more than half of those who retired before age 65 stopped working earlier than intended, many due to health-related reasons. Additionally, only 25% of employers with 200 or more workers offer healthcare coverage for retirees, a number that has been declining for decades. Here's a look at some of the potential options for those needing to bridge the gap until they're eligible for Medicare at age 65. COBRA coverage applies to all group health plans maintained by a private employer with 20 or more employees, or by state or local governments. If you are entitled to elect COBRA coverage, you must be given an election period of at least 60 days. COBRA requires the continuation coverage extend from the date of the qualifying event to a limited period of 18 to 36 months. The time depends on the type of qualifying event that gave rise to the COBRA rights. For example, an employee covered under a qualifying event, COBRA coverage can last for 18 months from the date you elect coverage. However, dependents can receive up to 36 months of coverage if you switch to Medicare, get divorced, or die. Spousal coverage. This is best cost-effective option for many earlier retirees. In the marketplace, early retirees may be able to secure coverage via private insurance through the public health exchanges. Through the Affordable Care Act, public exchanges offer a range of different plans in different tiers: bronze, silver, gold, and platinum. As we wrap up our discussion today, planning for healthcare and retirement is a challenge. Enrolling in the Medicare to avoid penalties, deciding what the best option for supplemental coverage is, are all complex and unique to your own situation. There are also strategies to be more efficient around taxes, such as Roth strategies or utilizing health savings accounts. Since health care represents a significant cost and poses risks in retirement, every effective income plan will take health care factors into consideration. Planning for funding out-of-pocket expenses in retirement will certainly impact your savings and investment plan. Having a thorough, well-thought-out plan for healthcare costs in your retirement is important to avoiding some surprises. I hope you enjoyed today's discussion on a complex subject. I hope you found value in some of the concepts we discussed. Go to budwealth.com and take our risk quiz. It's a unique way of looking at what risk level you may be comfortable with in your current portfolio. Download our free ebook on the Secure Act. What does it mean for you? At our website, budwealth.com. If you have any specific questions on your own situation that you'd like answered, schedule a follow-up phone call or a Zoom meeting or an office meeting through this tool on our website. Schedule an appointment. It's my way of thanking you for investing some time in this topic. And for those of you attending that are not clients, email us with your mailing address, and we'll send you our introductory kit to those that would like to learn more about our firm and our client life process. As your life unfolds and your goals evolve, our client life process continues to be refined in each stage, helping you reach your goals. Thank you again for attending today. You can email me at jbud@budwealth.com. Thanks again for your time. I hope you have a great rest of the week.